Hello everyone, I am Dr. Nivedita Kaul, Senior Consultant Gynecologist at CK Birla Hospital, New Delhi. So today I shall be talking about the relationship of fertility and menopause with aging. So how does age affect a woman's fertility, that is her ability to conceive? Now this is a very relevant, important topic nowadays because as we know, many couples are delaying planning their pregnancy until the late 30s or 40s. We also know that a woman is at her peak reproductive potential during her 20s. By the age of 30, her fertility starts to decline, and this decline is faster after her mid-30s. Now this is because women are born with a fixed number of eggs in their ovaries, and as their age increases, the number of eggs starts decreasing. Not only that, the remaining eggs are more likely to be of poorer quality as a woman ages. In addition, with age, problems related to the uterus like fibroids or problems related to the ovaries like endometriosis are likely to come up, further compromising a woman's fertility. So if you are above the age of 35, have been trying to get pregnant for more than 6 months and have not been able to do so, you must contact your gynecologist. So if we want to now talk about menopause and aging, we know that as a woman ages, a lot of changes come about in her reproductive organs, and they are mainly related to the changes in hormonal levels with aging. A very important or prominent change is the stopping of a woman's menstrual cycles, something that we call menopause. So the normal age of menopause in India is about 50 years with a range of 45 to 55 years. Why does menopause happen? It happens because the ovaries stop functioning. The ovaries stop producing eggs and they stop producing a hormone called estrogen, which causes our menstruation to cease. But the changes leading to stopping of menses actually begin a few years prior to menopause. And these few years prior to menopause are called the perimenopausal years. During the perimenopausal years, a woman can experience changes in her menstrual cycles. Like initially, her cycles might become more frequent, followed by cycles becoming more delayed or prolonged and scanty bleeding, eventually leading to cessation of her periods. So generally, if a woman has not had her periods for more than a year, we say that she has gone into menopause. Any bleeding that occurs from the vagina after 1 year of stopping of menses can be potentially abnormal and needs to be evaluated by a doctor. Along with the changes that happen in the menstrual cycles, a woman can also experience other symptoms during menopause, some of which can be very distressing. Like common symptoms experienced are vaginal dryness, vaginal irritation, painful sexual intercourse, urinary problems like urinary frequency, urinary urgency, increased predisposition to urinary infections, vaginal infections. All this becomes common after menopause. Some women can experience hot flashes, and these can be extremely annoying. Changes like weight gain, changes in mood, irritability, anxiety, depressive changes can also be common after menopause. Now, other than this, the declining levels of estrogen also predispose menopausal women to some potentially serious health problems like a decline in the bone mass called osteoporosis, which makes a woman susceptible to fracturing easily. A woman is more likely to develop problems like hypertension, diabetes, heart disease after menopause. So if you are having symptoms related to menopause and these symptoms are distressing to you, it is important to reach out to your gynecologist because we have both hormonal and non-hormonal treatments available now which can help you to combat these menopausal changes effectively. So in the end, I'd just like to mention that if a woman effectively wants to combat the changes that take place in her body with aging, the single most important thing that she can do is lifestyle modification. Following a healthy lifestyle, regular exercise, minimizing the consumption of junk or processed food, taking a lot of whole foods, along with that, keeping away from alcohol and smoking and avoiding stress can go a long way in helping a woman handle the age-related changes in our body.